In York County, we are experiencing a spike in cases that has largely been attributed to our nursing homes. And I've had a concern raised with me that the department's March 18th guidance mandating nursing homes to admit or readmit someone with COVID-19 impacted the lives of residents and staff and went beyond CDC guidelines, which say that nursing homes should admit any individual that they would normally admit to their facility as long as the nursing home can follow CDC quarantine guidance. The department's guidance to nursing homes created some confusion as to whether they were required to accept someone who was infected or whether a nursing home could refuse. Can you clarify that matter for us?
Sure. So we, following the CMS guidance, which really was very clear to us, is that unless there were other mitigating factors, that people should go back to the facility from which they came. We implemented that guidance. Now, I want to be very clear. These are patients that were in a specific nursing home. Those patients contracted COVID-19 in that facility, with perhaps other patients who contracted COVID-19. How did they contract COVID-19? They contracted, as I said, from very brave, but unfortunately staff that had either asymptomatic or pre-symptomatic COVID-19 that had unwittingly brought it into the facility, which is why really the previous statement about that the prevalence of COVID-19 in the facility reflects the prevalence of the county with which the facility is located. So patients contracted COVID-19. Say one or two of those of the patients got very ill and were transferred to a hospital. When the other patients stayed in the facility where they were. When the patients recuperated in the hospital and were better, they came back to the facility from which they came, where they contracted the COVID-19 in the first place. In addition, we worked with every facility to make sure that in terms of our consultations and whatever they needed to make sure, PPE, et cetera, that they could cohort those patients and cohort staff to be able to take care of those patients that were coming back to the facility from which they came, where they contracted the COVID-19. I do want to highlight the words of CMS Administrator Seema Verma, who had talked about that, her policy that she put down to us, is our actions allow hospitals to reserve beds for the most severely ill patients by discharging those who are less severely ill to skilled nursing facilities, quote and unquote. So those are the guidelines that we received. We implemented those guidelines. We worked with the nursing homes to take back the patients that they had sent to hospitals that recovered and came back to those facilities.
Thank you. If I could just follow up on that, Secretary. As you can imagine, we all have constituents who are very fearful of their loved ones becoming infected because of your guidance. And a lot of people shared with me that they lacked the resources or the wherewithal to move their parent, their grandparent, their loved one out of these facilities. So many of the families were very alarmed. And you spoke a little bit about what the department was doing to assist nursing homes in receiving these recovering COVID-19 patients so that other residents would not become sick. Was there any additional training? Was there a creation of any special COVID-19 units? Did you do additional testing? Could you elaborate on how the department assisted those facilities?
Sure. So we assisted facilities ourselves in terms of working with them about the mask fitting that was discussed and infection control procedures. We also contracted with an organization called ECRI, who testified. I don't know if it was with the Senate or the House, but they testified to their consultations. We contracted with them to do more than 100 consultations with nursing homes. We had education and webinars through the Patient Safety Authority and with our staff about all of those. And as the Lieutenant Colonel had pointed out, where there are specific staffing issues, we would send in the National Guard bravely to go in, or when we had the CDC or Health and Human Services, they would go in. We would work in terms of cohorting. We would work in terms of pushing out personal protective equipment so they could successfully take care of those patients. In terms of testing, until May, the testing, we would test any symptomatic person in any facility. So really since April in May, we have had the ability to make sure that any symptomatic person in any of these long-term care living facilities or symptomatic staff would get tested. And they would get tested a lot through our laboratory in Exton, or the samples might have been sent to LabCorp in Quest. What we did not have the ability to do is what we're doing now, which is this large population-based testing of every staff and every patient to try to pick up those asymptomatic carriers that are bringing it into the facility in the first place, or perhaps a patient that could be spreading it because they're asymptomatic, but they have the virus. We did not have that capability until later on in May, which is when I signed my first order for the mass testing, my first recommendation for the mass testing. We then ordered it in June because it wasn't being picked up by the facilities as quickly as we wanted.
Thank you. And there were no patients who were knowingly put into a nursing home that were COVID positive.
So as I mentioned, patients that came from a nursing home that were COVID positive, sent to the hospital.
Correct, but no patient was put into, no new patient was put into a nursing home.
So we have a few cases, Sarah, do you have any granular detail, where patients were sent to rehab facilities that had full ability to take care of them because we had to decompress the hospital? There's a handful of those cases. Sarah?
Yeah, I think it's important to highlight in our guidance that we have for the facilities about the discharging of residents, that it points to the HAN 502. So the guidance itself just points that HAN. You have to actually go to the other document. It's that document that lays out very clearly how to properly do those transmission, that cohorting and the appropriate rooms and isolation that should be given to a resident if their status of COVID-19 is unknown, or if their status of COVID-19 is known, and then therefore needs to be separated from other individuals, residents at that facility. So it's the two documents work hand in hand with each other.
So we asked
So
our
essentially,
team to
what I just need some clarification on, because of a concern that was raised by a constituent, that an individual was discharged as a known COVID patient into a new nursing home facility. Would that have been possible or not possible based on this guidance?
So as I mentioned, we had actually done a deep dive on that, and there were a handful of facilities that were prepared to take those patients. So we can get you more, specific granular detail. I don't have it right in front of me, but there were a handful of cases where patients were discharged with COVID-19 to a facility that did not have COVID-19 in the first place. And none of those led to outbreaks. So we have done a deep dive on those handful of facilities, and none of them led to outbreaks in the facility. And we can send you that specifics.
I would appreciate that. Thank you very much, Secretary. Thank you, Madam Chair.